Wednesday, and as always, we are joined by Dr. Syed Hussain of Trinity Health of New England. Welcome back.
Thank you.
So glad to have you here. Okay, now we have to talk about measles first. At one point, it was declared eliminated in the U.S., but we're seeing that trend change, and now there are some surges in those cases, right?
So it's unfortunate, Symphony, we've regressed as a nation. So 25 years ago in 2020, in 2000 actually, we were declared measles free. But now, since then, we've had smaller outbreaks every year. But this year is the worst outbreak that we've seen so far in the number of cases. There are now more than 1,200 confirmed measles cases, which is likely an undercount because not everybody gets attention or seeks help. And that's more than what we had in all of 2019 when we had a very large number as well. For that year alone, we had more than 1,200. So we're just 6 months into this year and we've had over 1,200. Most of these cases, if you start drilling down into why, is because of falling vaccination rates for children. That's the biggest driver. And the outbreaks we've seen are in pockets of under-vaccinated communities, such as West Texas, for instance. 38 states so far this year have been impacted, and so it is concerning. We have to get back to our basics. There's a very safe and effective vaccine, the MMR vaccine, 2-dose vaccine, that is that can prevent this highly contagious disease from spreading.
And is that typically available to just children, or can adults also maybe get a booster?
It's part of the childhood immunization package. So the silver lining I can share with viewers is that in states that have seen these outbreaks happen recently, we've seen an uptick in children getting vaccinated. So it's never too late. If you're one of those that, for some reason, over the last 4 years, we've seen kindergarten-age children, for instance, vaccination rates fall, and you know your child has not gotten the MMR vaccine, now is the time.
All right, now let's talk about ticks. A lot of folks are spending time outdoors now that it's summer, but it seems to be a bigger problem here in the Northeast.
It is. Part of it is because of weather changes that we've seen. So we've seen more wet days. If it's a hot, dry day, that kills off ticks. So this is the deer tick that we're talking about in particular, or black-legged tick. And these, so just to take those regular precautions. This is tick season, by the way. So if you're going outdoors, making sure you're trying to cover your, legs, your arms, and try to use 0.5% permethrin, for instance, to treat your clothes or gear if you're going outdoors camping. Use EPA, that's Environmental Protection Agency approved insect repellent. Some insect repellents cannot be used in children under the age of 3, so make sure you look at all of that. But taking those basic precautions, and then when you do come home, remove your clothing, look for any ticks. Look for any ticks on your skin. They can be as small as a size of a poppy seed. And if you do see a tick, remove it with tweezers. And if you see a rash, then please seek medical attention.
Yes, my dad had to come to the rescue one day. We went hiking as a family, and I had like a little itty-bitty one on my leg, and he just plucked it off with some tweezers.
Yes, do not wait to remove the tick.
Yeah.
That's right.
All right, and we have one more we have to touch on quickly before we do head out. There's a new study out that says American kids have become increasingly unhealthy over the past 2 decades. What are they looking at in that study?
This is concerning. This validates some of the trends we've been discussing over the last few years related to childhood obesity, childhood disease, depression, mental health conditions. And so we need to have a multi-factorial approach in terms of how we tackle this problem from a federal level, state level, city level, community organizations to help reset some of these parameters around childhood disease.
Yeah. All right, like I say, I like to say, get those kids away from the screens, have them go outside,
that's right. Activity,
play outside.
Better diet, healthier diets, less processed food, for instance.
Water.
Exactly, all of those. Going back to those, tried and tested basics is really important.
Back to the basics. You heard it from the doc. All right, thank you so much for joining us.